Hi and welcome in my project demo guide of MedGem for MedGemma Impact Challenge. In rural healthcare, uncertainty is dangerous. Imagine a GP faces a complex skin lesion, a subtle fracture, or a retinal scan, but the nearest specialist is weeks away. We rely on scarce radiologists, but the shortage is actually universal. We lack specialists everywhere. That's why we built MedGem. MedGem isn't just another X-ray reader. We realized that a true AI assistant needs to be as versatile as the doctors it serves. So, we built a universal clinical assistant. Let's peel back the curtain and look at the code powering this engine. First, we initialize the core. We aren't using a massive server rack. We're loading Google's efficient MedGemma 1.5 model. This 4 billion parameter size is the sweet spot, powerful enough for deep reasoning, yet light enough to run on edge devices in remote clinics. This MedGem inference engine class is the heart of our innovation. It doesn't just predict, it adapts. In high-sensitivity mode, for trauma, we coded this specific verification loop. It forces the model to double-check cortical margins for subtle fractures it might otherwise miss. In general mode, it identifies the modality, derm, X-ray, MRI, and adjusts its prompt strategy instantly. There is also treatment planning engine inside the model giving advice, not only just the cause. Finally, this Gradio block builds the UI. It's what connects our complex backend to the frontline worker, providing real-time scans and reports with zero friction. Let's put a query here and let it run now. Let's say I have a fever for 5 days. It automatically gives a proper report along with medical suggestion and advice. But diagnostics are only half the battle. A perfect report is useless if the patient is confused, because most of the report consists high-level medical term for common people to understand. That's why our system includes a patient-friendly translator. It takes clinical jargon, erythema or comminuted fracture, and converts it into plain language like redness or shattered bone. This builds trust and literacy. We aren't trying to replace doctors. We are trying to give every doctor, nurse, and health worker the superpower of a multidisciplinary team in their pocket. With MedGem, we are moving from a world where expert diagnostics are a luxury to a world where they are a standard. Thank you.